The big question is, should you pursue a degree in physical therapy, a doctorate of physical therapy degree now? So here's my 2 cents now that I've went through it all and I have my doctorate of physical therapy degree. If you are after the money, you're going to be very unhappy. Why? Because it's not the highest paying degree with this amount of education. There's many other degrees that could pay you a lot more, with some of them even less education. To get your doctorate of physical therapy degree, it's 4 years of undergraduate school, a lot of prereqs, and then a 2 to 3 year program, depending if you want to do a hybrid program, which is very difficult and stressful, which the 3-year degree program is also, but these 2-year programs are accelerated, so you're learning everything at a faster rate. So in total, if you take the prereqs, unless you're taking the prereqs at the same time as your undergrad classes, it's probably going to take you 4 years of undergrad if you go full-time, another year of prereqs if you got some done while in undergrad and you just had to take a few more after graduation of undergrad. It's like 5 years. And then if you take a 2-year program, that's 7 years. That's saying if you get accepted in the first year. Or 8 years if you go into a 3-year program, a traditional program, and that's saying if you get accepted the first year. So say everything goes perfect and you get done with your undergrad and your prereqs, and then you apply and you get accepted right away. That's if everything goes perfect. That's 7 to 8 years of schooling if everything goes perfect. And the average salary in California, starting off as a new grad, it's $85,000, I think, the last time I checked. And that's not a lot. With regular schooling right now for graduate programs being about $100,000 to $150,000 in debt, and some programs like St. Augustine up to like $250,000 in debt, just because the programs are so expensive. So you have to take all that into consideration. You have nursing degrees that you could get your associates in nursing for like $10,000 or less, and they're only making a little bit less than us, and some of them are making more than us depending on where you're working and what type of work you're doing. With like $10,000 in debt, that's lovely. That's great. So unless you are really set on doing your physical therapy degree, you really have to think about all this stuff, because that's the things that they don't tell you. That's the things that the programs don't tell you. They try to pump you up to be a great physical therapist, to be an orthopedic specialist, to be a neuro specialist, to go after you graduate from your doctorate degree to go seek residency, which is another year and another like 15 grand just to be further in debt. So you have to really take all that into consideration. You don't need your residency, but they encourage you to get your residency just so you could be better equipped to be out there in the field. When there's other programs, and occupational is just the same as PT. You get paid about the same. Education is just your master's degree, but the debt's about the same. So like honestly, it's not much of a difference. Here's the big difference programs. Here's the different schooling that you should be considering if you're thinking, like if you're still up in the air about stuff. There is nurse practitioners, which it'll be better to go into nursing first, get your associates in nursing, take some online classes to get your bachelor's in nursing, and then after that, get into a nurse practitioner program while you're working already. And there is some hybrid programs also now available, and they're 2-year programs. And nurse practitioners in California, they're averaging starting after graduation about $130,000 to $140,000 a year. Physician assistant programs, those same thing. You get your bachelor degree, take the prereqs, and it's a 2-year program, and you're starting off like at $140,000 a year also. So if you really have to consider what you really want to do, because money is a big factor. You're going to be in the same amount of debt with all these programs. You have to consider all of them are going to be about $100,000 or $100,000 plus. Anesthesiologists too. It's not that much more schooling. You have to make sure you do your diligent research before you commit to so much debt, because it is very expensive and it is very time consuming. So if you go to school for 8 years or 9 years, if you don't get accepted in your first year of your doctorate physical therapy program, and then so now you went to school for 9 years to make $90,000 or $85,000 a year. It's not much. And that just the $150,000 or the $100,000 of debt is just for the DPT program. That's not saying if you got debt from undergrad also. So you have to play all these factors, play all these scenarios down, write them down, take notes, compare and contrast, if I do this, like, because it's a big commitment. And every one of these programs is a big commitment. They're all going to be about the same amount of time, but there's a big pay difference in each and every one of them. So do your research before you commit. I love physical therapy. I love what I do. And I'm excited about what I do. Every day that I go to work, like, I'm excited to help people out, to make a difference in their lives. But I'm not happy with the pay. Like, I'm really not. And that's why I am outsourcing and trying to figure out other ways to make money. And I'm doing home health, and I'm doing acute care, and I'm doing outpatient, and I'm working on starting my clinic just because I'm not happy with the money I make. And as a worker, I don't think I'll ever be happy with the money I make because of how much I have to work compared to a nurse practitioner, compared to an anesthesiologist, compared to a physician assistant, compared to a nurse, that they all make very good money with some of them the same amount of debt, except the nurse, they have way less debt. So if I were just to say it off the top of my head, debt to income ratio, nursing degree. Go do it. Go get your nursing degree. That's going to be the best time and income investment that you could make for such low amount of debt. But if you really want to go out and make that extra income, make, that nurse practitioner income, that physician assistant income, it is going to take you about 7 to 9 years, depending if you get accepted or not. And I personally, when I speak to people now, after I have personal experience with schooling and the money that I'm making and the debt that I'm in, I always encourage people to not just commit 100% to physical therapy unless you really, really have a big passion for this and money is not a factor for you. So hope that helped out. If you have any more questions, make sure to reach out. Peace out.